Hi, it's Goddess Cecilia. Welcome to Dive Deeper. Let's talk about abortion access and why it's so integral to healthcare. There's a lot of negative information, misinformation, false information out there about abortion. At the end of the day, it's no one else's business but your own whether or not you are going to get an abortion. Let's make that very clear. I could come up with a bajillion reasons why people are choosing an abortion, and at the end of the day, it doesn't matter because it was their personal choice to do so. Let's talk about why this is important. Throughout the history of abortion access, we know several things. We know that access to legal, medically supervised abortion prevents countless deaths of pregnant people. Otherwise, they will go out and search for another way to terminate a pregnancy that isn't supervised by someone who can care for them if something does go wrong. We know that the majority of people, over 50% of people who access abortions, are people already with families, already with kids of their own. And so there's this constant slut-shaming rhetoric that comes from the idea that abortion is a common way to be able to have a lot of sex without any consequences. And we know that that's not true. Abortion is a very serious, very personal choice for a lot of people, and they are often faced with a decision to ensure that they are still able to take care of themselves and or other people that they care for. So to assume that people are using abortion as a way to continue to be promiscuous is slut-shaming at best and completely false. We know that becoming pregnant is extremely dangerous and traumatic. Even today, even with today's medical standards, there are still so many pregnant people who end up potentially dying from the birthing process. And that is due to a plethora of reasons, from their own health reasons all the way up to straight up medical racism. We know that Black maternal mortality is exceedingly high, and that's because we know that the healthcare system has been built and is continued to be taught that women of color, specifically Black women, are not feeling pain at the same levels, that they're not feeling pain at all when they are saying that they're feeling pain. And so many Black women, other women of color, are taught constantly to minimize the pain that we are feeling. And that includes during pregnancy. I can tell you on a personal level, I was definitely pre-eclamptic, which means that essentially my blood pressure kept raising and there was a really high potential that I would have a stroke while being pregnant, which is extremely dangerous for myself and for my baby at that time. And I have to admit, I minimized any symptoms that I was feeling. I actually can't even tell you if I was feeling any negative symptoms because I know that I've also been taught to minimize when something feels wrong, minimize whether or not I need help. There's so many potential things that could have gone wrong, and we don't pay enough attention to the fact that pregnancy can be extremely dangerous for the pregnant person. This fight about abortion access ignores so many of the other factors that come into play when someone is pregnant and when they have a child. We don't have universal access to childcare. We don't have universal health care to ensure that if a child is sick, that they can be taken care of, or if a parent gets sick, that they can be taken care of without having to worry about the child. We don't have parental leave. where parents are able to stay at home for an extended amount of time without worrying about their bills, just so that they can bond with their child. So to tell people that abortion shouldn't be an option as far as healthcare ignores so much of the difficulties of being a parent and of being a child in this world. Access to abortion is exceedingly important. People who get pregnant need the ability to choose whether or not they carry a child to term, whether for their own safety, for their family's safety, or because it's none of your goddamn business anyway. So it's really important that we have full, unencumbered access to abortion, because abortion is healthcare. And really, everybody should have access, equal access to healthcare.